about each of these enough so you should be able to recognize them. So thoracic aortic aneurysm, this is the biggest group. This is part of those familial syndromes you learned about in medical school. And again, I'm not asking you to become an expert, I'm asking you to learn themes. So remember that these are the non-inflammatory diagnoses that you see when you're asking me to evaluate someone for possible Takayasu's or possible giant cell. These diseases are basically caused by two different problems. One is a problem in the structure of the aorta itself, possibly due to a mutation of actin or myosin. And the second is a mutation in the TGF-beta pathway, because TGF-beta is important to create the extracellular matrix that supports the aorta. It's actually really common. The incidence is actually thought to be a little bit higher than the number on the screen. And the reason why is because a lot of these patients don't actually get a formal diagnosis. There are two tricks to making this diagnosis. The first is that although it is autosomal dominant, there's incomplete penetrance. So just because you do the family tree doesn't mean you're going to pick up on every single case of a mutated gene. The second problem is there is incomplete penetrance. So even if someone has an abnormality, they may not manifest in exactly the same way as another patient with exactly the same abnormality. Now, when you think about these patients, we think about them in two different groups. We think about the syndromic diseases, which is Marfan's and Ehlers-Danlos, and again, the stuff you learned about in medical school. And we think about the non-syndromic diseases. And this is a big fat lie, because the reason why that these diseases are so challenging is because the gene mutations that cause the syndromic diseases are actually the same as the genes that cause the non-syndromic diseases. And we'll talk about that more in just a little bit. So, if you're already falling asleep and you learn nothing else today, you have to come away knowing about Marfan's disease, because this is the most common of the mutations we're going to talk about today.